Good morning, Dr. PK from DrPKLyfe. In this video, I'm going to talk about lipoprotein, cholesterol, genetics, and heart disease risk. Most people think cholesterol is just a number, but heart disease is not caused by cholesterol alone. It's caused by lipoproteins. Today, I'll explain in very simple language what lipoproteins are, different types, and why they matter, and how they cause atherosclerosis, the role of genetics when to treat, and how to prevent heart disease properly. What are lipoproteins? Fats like cholesterol and triglyceride cannot travel freely in blood because they are fat. They are not soluble. So your body packages them into a special carrier protein called lipoprotein. Each lipoprotein has fat inside, which is cholesterol and or triglyceride. Protein outside is called apolipoproteins. Think of lipoprotein as a delivery truck moving fat through your bloodstream. There are different types of lipoprotein. One is chylomicrons. They carry fat from food, very large particle, and they do not cause heart disease because they're very large. They cannot enter arterial wall. VLDL, very low density lipoprotein. They are manufactured by liver and they carry triglyceride and they can turn into LDL, which is a bad cholesterol. Low density lipoprotein, and they carry moderate risk for heart disease. Then LDL, which is bad cholesterol, they carry cholesterol to tissues. They easily enter arterial wall, and they are the main cause of plaque buildup. Important point is this: it's not just LDL cholesterol level, but the size of LDL particle and the numbers, they matter more. So some people, even with a normal LDL, can have a high risk of heart disease, like South Asian population. People from India, Sri Lanka, Nepal, they have a smaller LDL particle and they're dense and they're sticky. So even with a normal cholesterol, they carry the high risk for heart attack. Now, number 4 is HDL. It's good cholesterol. They remove cholesterol from arteries. They're protective. They're like think about as a cleaning agent. But very high HDL does not always mean low risk. Now, let's talk about ApoB, the real risk marker. So every bad particle like LDL, VLDL, IDL, which is intermediate density lipoprotein, and lipoprotein A, they all carry one ApoB protein. So ApoB protein number tells you the risk of heart attack. Higher the number, higher the risk. So number of dangerous particle is equal to ApoB basically. ApoB is better marker than LDL cholesterol, okay? How atherosclerosis develops: LDL particle enter arterial wall, they get oxidized, immune cells attack them, swallow them, they create foam cells and plaque forms and grows, and sometimes plaques rupture, leads to clot and leads to heart attack and a stroke. Now this process can start 20 to 30 years prior to this attack. So the prevention should start quite early. Genetic factors: familial hypercholesterolemia, where there's a very high LDL from childhood. Heart attack happens in 20s and 30s. Lipoprotein A, it is entirely genetic. One time test should be done in your life. It will tell you if you have lipoprotein A elevated or not. It's a strong independent risk factor. Insulin resistant genes will cause high triglyceride, low HDL, and a small dense LDL. It happens in South Asian population, people from India, Pakistan, Sri Lanka, Nepal, those areas. They have insulin resistant genes. They have high triglyceride, low HDL, and a small dense LDL particle. Now, when to test and treat? Treat early if you have family history of heart disease, diabetes, high blood pressure, obesity, or smoking. Treatment is recommended if LDL is more than 190, ApoB is more than 90, even 70 if you have more risk factor, or if lipoprotein A is elevated. Calcium score is more than 0 or prior heart disease, those are the indication for treatment. Prevention and treatment. Lifestyle, cut out sugar, refined carb, be active every day, sleep well, reduce your stress, stop smoking, medication, statin, ezetimibe, PCSK9 inhibitors, and omega-3 for triglyceride. So to recap, heart disease is a particle problem, ApoB number. Genetics matter a lot. Prevention must start early. Don't get into, don't follow the quack doctors on the internet who scare the heck out of for statin and those other treatment. A statin is a great medicine. If you don't tolerate it, that's a different thing altogether. But don't just have a bias that it's a bad medicine. Everything has side effect. What does not? And you have ibuprofen has side effect, acetaminophen has side effect. They all medicine has side effect. But if side effect is not happening to you, then look at the positive things it does to your body. It literally saves people from having a stroke or heart attack. Treat your risk, not just numbers. So thank you for watching.